Guys, it's Sunny. Good morning, and I hope that you're doing well today. We're going to talk about how you can reduce your risk of a heart attack, basically. Everybody wants to know that. And there's a nice meta-analysis that's just come out looking at multiple randomized controlled studies, asking the question, what is more effective at reducing body weight, improving your cholesterol, and helping your blood pressure? Combining intermittent fasting and exercise, or just exercise alone? And guys, this is not super surprising that they did find, in looking at studies, and the studies included 360 adults. Some had metabolic syndrome, some had non-alcoholic fatty liver disease, some were overweight, and they found 14 randomized controlled trials that they looked at. And basically, what they found is that if you want to try and reduce weight, improve your cholesterol, improve your blood pressure, you really want to combine some intermittent fasting with exercise in order to get the most bang for your buck. And this is something also that when we think about intermittent fasting, it's important to recognize that when you are older, that fasting period may need to be a little bit shorter, like maybe 12 hours is the right length if you're older. The big effect from intermittent fasting, I'm going to just be totally honest here, what's that big effect coming from? The big effect is actually coming from probably a reduction in calories. Okay, so that might not, makes you wonder if it's the timing of it, but what we find is people are routinely eating fewer calories. And so here's the little screenshot of that: effects of intermittent fasting combined with physical exercise on cardiometabolic outcomes. So in short, this was December 2023, you want to combine them for the most benefit. And, it's really important, especially if you're older, to make sure you're getting adequate protein. And if you're going to do a protein shake or something like that after your exercise, you want to do it within, 30 minutes or around, before or after your exercise, so that you will have the nutrition in order to make more muscle. Because what we don't want to do is we do not want to be losing muscle. It totally thwarts our efforts. And if you're not eating enough calories, and that's the trick with intermittent fasting, is that you need to make sure you're fitting in a lot of good fiber, a lot of color, and adequate protein. I'm a big fan of eating around the outside of the grocery stores. I know different people need different things. Some people do great eating carnivore. Some people do great eating, actually even gluten, which, I used to say, no, nobody eat gluten. I know there are a few people out there who don't seem to have a problem with it. And this is all because it affects our microbiome. This is so the important things here are: combine a little bit of fasting with your exercise for the maximum cardiovascular benefit. Let's reduce that risk of heart attack. Let's keep you guys out of the hospital, and have an awesome day. Please click that subscribe, like, whatever the button is below, so that you can hear when I start to review another article that's going to help you feel your very best. All right, you guys have an awesome day.